Hello everyone, welcome to the channel. Today we are going to learn about triage and tagging in this channel of Nursing Companion. If you are not familiar with what triage and tagging is, it is something related with emergency nursing or disaster nursing. Triage basically means to sort or to organize. So here's the definition of the triage is the process of categorizing emergency department patients based on their need for the medical care. So what is triage? It is a way of categorizing, as I've said. So the category we are sorting it out is on based of the need of medical care. Okay. Next, we're going to see what are the objectives of triage. So there are several objectives, but I have here written only 7. These are the main objectives that you should be writing in your answer paper to get that full marks. First, let's begin here. Ensure immediate medical intervention. Focus on this few words: immediate medical intervention. Okay, so there should not be any delay. Next, care through the systematic initial assessment. During the cases of emergency, there is a lot of rush and chaos, and in that commotion, people often delay all the things. So, we have to immediately take the intervention because we are skilled as a nurse, we are skilled here, and we have to go through the whole process very systematically so we can provide maximum results in a better way, right? Next, ensure patients are prioritized accordance with the severity. So, what are the three we came across right now? Firstly, we have to provide immediate care, then, it will be a systematic initial assessment, then, the priority should be according with severity, then, reduce morbidity associated with the medical conditions. Now, assist patients requiring the treatment. A lot of patients does not, when you'll assess them, you'll understand that they do not need a lot of attention. As keep watching the video, because as we go further we'll understand what we are talking when we are saying that according with severity. First, let me give you a little example with the point number 5 that says that assist patient requiring treatment. Here we can see a lot of patients do not need a lot of intervention with the medical care. They just need a little bit of assessment. Then when you assess them, you'll understand a little assistant is necessary enough to provide and to let them achieve a better comfortable position. Okay, next, improve public relation by communicating appropriate information. In the case of, it's not only just emergency, though triage is basically given during the time of emergency or critical situation, but see, in all the situations communication is a very important factor. And in the time of chaos, if you are not communicating the right information, further damage, further physical psychological damage will happen. So correct information communication is very important. Next, the last point is improve patient flow in the emergency or disaster management. So let's quickly go through it all over again. First, we have to provide immediate care, then the assessment. From the initial only, we will start systematic assessment. We will ensure that the patient is categorized according to the severity. We will reduce morbidity, assist patients in requiring treatment, and improve public relation by communicating what we are communicating, by providing the correct information that is needed, thus improving the patient flow in the emergency or the disaster situations. Okay. Next, after objective, we are going to see the triage actually is categorized in, we're talking about the severity, the assessment of severity, right? So in this four category we are going to divide it. First, we are going to see what are the patients who are high priority, then medium priority, ambulatory, and dead. So all these four, you can see color blocks I have given. Actually, in this color only, specific color only, triage and tagging is done. For the red, high priority, medium priority yellow, ambulatory is green, and for the dead is need. For the triage is classified on basis of severity of injury. We have learned this before. Next, what likelihood of survival upon prompt intervention. Someone is in a state where you can provide just bandage. There's a cut, you can provide bandage, and you can move to the next patient. Or a situation where you have to provide CPR, or it's severe fracture, or is 85% 90% burns. In these cases severity is a lot, and so after assessing your understanding the patient is very critical, so a little help, a little medical intervention won't solve the problem, right? So the need for triage, you have to write that it classifies on the two bases: severity of injury and likelihood of survival upon prompt intervention. So after need for triage, you have to understand the principles of triage. Triage runs upon the principles, three principles basically there is. First, every patient should be received and triaged by appropriate skilled health professional. You can understand it pretty much. Then triage is a clinico-managerial decision and must involve collaborative planning. Now, what is collaborative planning? See, as a nursing personnel, you are not going to be the only healthcare professional there in case of emergency or disaster situation. They are going to be doctor, they are going to be therapist, team of several health professional, and nurses are one of them. So we have to take a collaborative planning. And triage processes should not cause any delay in the delivery of efficient clinical care. We have learned this on the very first objectives, that we have to provide immediate care. Okay, so the principles, there are three principles. What are this? Repeat with me. Every patient should be received, then collaborative planning we have to do, and it will be prompt. There should not be any delay. Okay, so I hope the principles are cleared. Next, we're going to do the components of triage. There are four components in the triage: personal, space requirements, equipment and supplies, and communication and information. So here let's see. In the personal, the individual working should be responsible, clinically knowledgeable, have critical thinking, have ability to rapidly elicit relevant history, display expertise in physical assessment skills, and possesses exemplary interpersonal skills. So personal means, let me simplify this statement for you. Personal means, suppose you are a nurse, you are a nursing personnel, you are a healthcare personnel. You to be in the collaborative team of triage, you have to be clinically knowledgeable. You have to be a responsible person there. You have to make smart decisions by using your critical thinking. And see, here it possesses exemplary interpersonal skills. You have to know how to communicate, you have to know how to handle that situation to provide the maximum care. Okay, so the as a personal, you have to have this certain kinds of traits. The area should be large enough to hold a sufficient amount of frequently used supplies and equipments. It is a very easy statement to understand that the place should be maximum enough. See, if you need 12 person, if there are 12 patients, so you need a room sufficient enough where you can accommodate 12 patients, right? That's next. We see equipment and supplies. Specific sufficient amount of frequently used supplies and equipments for existing triage and treatment policy. Need a different kind of articles. For providing CPR, you need different kind of articles according to the situation. that happened in the emergency situation, according to the kind of injuries happened, the kind of care you have to provide based on your assessment. The right and specific equipment supplies should be there. Until and unless there is right kind of equipment, you cannot provide the care that is needed to the patient. Next, communication and information. So the communication should be comprehensive communication system like alarm, TV, telephone, so that it can spread widely and you can communicate with a lot of people once at a time. I hope the four components of triage is clear to you. Next, we are going to see tagging. So, all patients should be identified with tags stating there what are the things that we are going to look for before tagging a patient. We're going to see the name, age, place of origin, triage category, and diagnosis. So, right now we have covered what triage is, what the principles, objectives, all the things about triage. So, we are specifying a patient according to that category, whether we are going to put that in red, yellow, green, or black, and according with that we have to provide the diagnosis and we'll tag the patient. Hopefully tagging and triage is clear to you. Now let me give you some examples of what I've just said in the triage. Four color coding is there. So high priority patients are the red patients, massive hemorrhage, gastric perforation, cardiac arrest, smoke inhalation, facial burn, poisoning. You can take a screenshot of all these colors and it will be easy for you to remember. Next, after that, we have yellow. Here we provide medium priority and it is femur fracture, abdominal pain, seizure, eye injury, like this. Next, green. For green, there's back pain, sinusitis, headache, or simple sprain, UTI. All this falls under the green category. Next, for the black, see the examples given: third degree burn with 95% coverage. So, if you have learned about burn in this semester, you'll know that a 95% third degree coverage patient is most likely to not survive. Although if you have not learned what burn is or anything, if you have any doubts about the chapter, please comment down below and let me help you with it. Other than that, see severe traumatic head injury, if there is spinal cord injury or chest crush injury, for those cases we will categorize it into black. Okay, hopefully you have understand triage and tagging. If you have any problems or any queries related to the video or any other topic, please comment down below and I'll see you in the next video. Thank you.